Good afternoon, everyone. It is my pleasure to welcome you here to our ongoing Tiger Tuesday series. Our distinguished guest today is Dr. Jeff Briggs, a graduate of Fort Hays State University and current Dean of the College of Health and Behavioral Sciences. And I guess we'll go ahead and get started if you're ready, Jeff.
I am ready.
All right, let's go. So we always like to start these with folks telling us their Fort Hays story, and you certainly have an impressive one. So give it to us.
Yeah, I have a Fort Hays story. I grew up in Broken Bow, Nebraska, so a small town in central Nebraska. And as I was coming out of high school, looking for institutions where I could continue my education, and actually I was looking for a place where I could be a student athlete as well, and ended up getting recruited to Fort Hays State University as a student athlete, and was a football player. And so 1979 moved to Hays, Kansas, and had a great experience as an undergraduate student, and actually as a football player as well. That was really a meaningful experience for me. And then I had the opportunity to stay on as a graduate assistant, and was a graduate assistant in the Department of Health and Human Performance for 2 years, and also served as an assistant football coach during that time. And then was fortunate enough to get hired on in a full-time capacity as an instructor in health and human performance and as an assistant football coach. So I stayed for another, I think, 2.5 years in that role. And then left. I was gone for about 15 years, probably less than 15 years, and worked at 4 other institutions, and then had the opportunity to come back to Fort Hays State University. I ended up getting my doctorate at the University of Arkansas, and then had gone on and assumed a faculty role at Stephen F. Austin State University in Texas, and came back as a department chair in the Department of Health and Human Performance in 1998. So I've been back now for over 20 years, and was in that role for 5 years, and then had the opportunity to move over here into the dean's role in 2003, and basically been in that role through that time, with a short/long stint as the interim provost for 2.5 years. I see Cindy Klein on here, so Cindy had to prop me up for 2.5 years in the provost role. A fairly long history at Fort Hays State University now, and certainly the institution has been great to me. It's been great to my family. Jolene, my wife Jolene, and we met here at Fort Hays State University in the early 80s. And I was actually going to bring it today, but we have Jolene and one of her friends defiled the quad by carving our initials into the concrete in one of the areas, and that actually, those initials still exist on the quad if anyone wants to do a little scavenger hunt. And our friend Tim Chapman actually cast those and made a cast for us. So we have those initials in our house from back in the early 80s. So it's just been a great place for our family, and we've been thrilled to be back here in Hays and at Fort Hays State University with just the outstanding work that we do as an institution. And having had the opportunity to be at 4 other institutions, I don't take for granted the type of work that we do, and the commitment that we have made to our students, and how well we serve our students, and how well we serve the constituents in our region. Just an amazing group to work with here.
So before we move on to the more serious topics, let's talk about your football career. So
yeah, I think I'm still in the record books. I haven't looked for a couple of years. I believe I'm maybe near the top in career fumbles and season-ending injuries. I'm pretty sure I'm up there in that regard as well.
They keep stats on everything.
I came in 1979, and it was a rebuilding program. Bobby Thompson was the coach. He was a first-year coach, and he was great to me. And there were a bunch of freshmen. We all came together, and we stayed very close, actually, over which is now 40 years. And we come back often come back now for the alumni the homecoming activities where our group gets larger and larger. So we had a large number of freshmen that actually started as freshmen, true freshmen in the program. Went 5 and 6 our freshman year, as I recall, and then just got successively better in each of those years with Bobby Thompson, and then Jim Gilstrap came in. And honestly, for a person coming from a small town in Nebraska, that my football experience was so informing to me, along with my academic experience. I met people from so many different backgrounds, and the diversity of my experience was so greatly enhanced by that. And as I had always told Deborah Preto, we were pretty sure that the Briggs has hosted one of the largest alumni events on the Friday night of Oktoberfest weekend, as our house filled up with a large number of our local friends, as well as our what we would call our football friends coming back to visit.
Well, if you need us to help you with registration on that anytime, just let us know, okay?
Yeah. You should sponsor at least the liquor bill, I would think.
I don't know that we have that kind of funding. So as a football alum, what do you make of where our football program currently stands?
Yeah, I'm absolutely stunned. I'm so proud of what Chris Brown and the staff have done, and I'm well aware of how challenging a position this is. We've been really fortunate over the years to have some really good football teams and some really good coaching staffs. And it's been very, very difficult as we moved into the MIAA. That was a losing proposition early on, because it was just going to take so much time to get up to speed, to get the funding, the scholarships funded, and the recruiting changed over. So as they came in and were able to expand that recruiting base, and we're able to continue to build out the facilities and the infrastructure to be able to attract the recruits. And this conference is second to none in Division II, as we're all well aware. So just an amazing job. And actually, as you mentioned that, I had a call a couple of weeks ago from one of our alums who down in the Houston area, who does come back now for Oktoberfest. And there's a student athlete down there who was looking to transfer that they wanted to promote Fort Hays State University to. And so it was really easy to be able to share that the type of program that a student like that would be coming into, where the opportunity for success and the high expectations athletically, academically, and the character development that's associated with that program, something we can all be really proud of.
Absolutely.
And we can say that about our athletics programs across the board. Curtis, as a lead in that area, has just done a great job, and a lot of respect for the coaches and the staffs that we have.
I agree. Even though they give me a hard time often, I think we have a great group of folks working over in Cunningham and beyond in athletics, and it's been a lot of fun. We've had a lot of great, amazing moments recently, and it's been so much fun.
Fan base is amazing. The level of support that we get for our athletic and our academic programs from this region is tremendous, as well as the philanthropic support. I know visiting with Jason Willoughby and the foundation folks, as we compare ourselves to our peers, the regional institution, rural regional institution peers, we're so far ahead of the game relative to the funds that we bring in. And that's such a testament to the commitment our alumni and our friends in our region has made to this institution as well.
Absolutely. And I really think part of that is because we have faculty members like you and administrators like you who are willing to share their time in efforts like this to, reach out in different ways to our folks. So we appreciate that from everybody who comes and joins us on these programs.
Well, what I will say, because I don't want to forget to say this, but I think the commitment that we have from the top down to this institution cannot be taken for granted either. With President Mason, the entire executive leadership team, as you take a look at all three of the vice presidents, with Jill Arnsdorf as the provost, who I answer to, Mike Barnett in administration and finance, Joey Lynn in student affairs. They are all fully committed to Fort Hays State University, and they do it in a very selfless way. And many of you may think, well, yeah, of course they work here. That is not the case. That's not always the case in higher education administration and their commitment to the institution at which they're temporarily perhaps employed. We're really fortunate, and it's really a special group. And including Jason Willoughby, as I mentioned before, and Joe Bain now as the university counsel. That's a group that really wants the institution to do well above their own personal success.
Absolutely. We are very fortunate indeed.
I hope they're listening in on this, because when it's merit pay time, I'd like to take advantage of those positive statements.
Well, we are recording this, so I can send the link directly to them. If you would
please
like.
Send that link directly to them. Okay. I don't want to waste that.
I will absolutely do that. And you will note I was agreeing with you, right? So just right. Okay, let's turn our attention now to the college. So, because ultimately we're here to talk a little bit about what's going on in your college. I know one of the programs that's expanding is the social work program. Can you tell us about that and any other, new initiatives that are going on in the college?
Yeah. Let me give you a quick overview of the college first. We're the College of Health and Behavioral Sciences. And so we have 6 academic departments that make up the college. And I'll just kind of go through them in alphabetical order. They're easier for me to remember that way. So we have the Department of Allied Health, which is our medical imaging programs. We have the Department of Communication Sciences and Disorders, where we prepare speech language pathologists. We have the Department of Health and Human Performance, which has a number of academic programs from teaching, coaching, athletic training, exercise science, etc., recreation, sports management. We have the Department of Nursing and the Department of Psychology and the Department of Social Work. So 6 really strong academic departments with a whole host of high quality programs. One of the things we're really proud of the 5 colleges, academic colleges that make up the institution, we bring nearly 1/3 of the students to our campus. So about 1/3 of the freshmen who come to campus major in one of our areas of study, and about 1/3 of the students who are on our campus as residential students are in our area. So we have a real strong presence. We have a real strong student learning outcome profile. So our students, there are careers available to these students and highly sought graduates. And so we're really proud of all those programs. We're also home to the Senior Companion Foster Grandparent Program, which is a federally funded grant program where seniors provide support for other seniors, whether that's to keep seniors living independently in the community, or the foster grandparent program actually works with students with special needs in the schools, or with additional needs in the schools. And then also within those programs, we host the Department of Intramurals and the Wellness Center and the Aquatic Center and some of those areas as well. You'd mentioned specifically the Department of Social Work. That has been one of the fastest growing programs on our campus. They've been in our college now for about 5 years. A great department. Tim Davis is the department chair, provides great leadership along with those faculty and staff. We recently launched a Master's of Social Work degree program. We'd only had a baccalaureate program previously, and so we got that master's degree approved last year, which was no easy task. And we have nearly 60 students in that program currently pursuing the Master's of Social Work degree, which is a significant need in Western Kansas. There are a paucity of providers in that area. And so that's been really important to us. We also just launched this fall an online Bachelor's of Social Work program, which is fairly unique throughout the nation. So we've been able to leverage our expertise in delivering online programming in social work. And as we're talking about social work, one of the real unique pieces of that's been going on for quite some time and expanding more recently is we're actually delivering face-to-face BSW programs at a number of our satellite partner sites. So we've been in Garden City for a number of years. We added a site in Dodge City. and Liberal and Colby, where we have students who are being educated face-to-face in the last 2 years of the social work program. So it's been a really nice piece serving these Western Kansas communities and being able to provide individuals in those communities an opportunity to educate and place and then fill those real critical needs in those communities as well. Who else do you want me to talk about? I can go on forever, Shelly.
Well, we only have 30 minutes and we've used up half of it. So, but I do want to remind everyone, if you have any questions, feel free to chat them to us and we will open things up at the very end if you want to ask questions directly, you know, unmuting yourself and that kind of thing when we get to that point. But if you have any questions in the meantime, feel free to chat them to me and we will certainly ask them. Let's talk about partnerships. I know that there's a partnership between the nursing department and Hayes Med, and I'm sure that there are others that I'm not aware of. So can you share about those?
Yeah, partnerships are really critical to our success in all of our programs. And the one you referenced, we were able to, we really have a need to enhance our simulation opportunities as we educate our students and in all of our programs actually. The simulation has become a real critical piece to the pedagogical approach. And in the Department of Nursing, we've had a simulation lab that we've tried to grow over the years. And as simulation became more and more normalized and much more high fidelity, we were able to partner with Hayes Med, the University of Kansas Health Systems, Hayes Med, and the Hansen Foundation, and build out our imaging or our simulation center in Stroop Hall, and opened that a few years ago. And it's just been a great opportunity for our students to have a much more rich preparation experience prior to going out into the clinical setting. And in that partnership, then we also, Hayes Med also comes in and they provide opportunities for their employees to continue to upgrade their skills and to go through a variety of simulation experiences as well. So being able to work with Eddie Herman and the Hayes Med administration, as well as the support from the Hansen Foundation, that is really a centerpiece of excellence here in Western Kansas. And the simulation and the timing's been perfect for us as well. With the pandemic planning that has had to take place, a lot of our programs have really had to enhance their simulation opportunities and to be able to meet student needs in ways that were different. And so being a little ahead of the curve in that regard really allowed our faculty and staff to be a little more thoughtful and creative to meet some of those challenges. And so that's the whole partnership piece is so critical in our programs. And so when you think about our medical imaging and our school psychology and our health performance, sports management folks, we need partners for our students to be able to get clinical experience, to get practicum experiences. Almost all of our programs have those requirements, and to go out and do internships. And because that is where the real top level learning occurs. As we close the loop on the academic experience, it is being able to bridge that gap from theory to practice. And we rely so heavily on those partners for those types of experiences, as well as then being able to partner with us to keep our facilities up to date and to enhance our labs and our technology and our equipment. We're a real expensive college, by the way. We have, when we need a new toy, that toy may be $90,000 or $110,000. And so it's important that we make a lot of friends. We need a lot of friends to continue to provide our students the opportunity to be able to train and be educated in a state-of-the-art scenario. And our groups have done a great job. The philanthropic support we've had has been tremendous, and in all of our programs, we've been able to expand our technology and our speech language pathology program, and we do a lot of outreach activities in our speech language pathology program as a part of that as well. And those are partnership pieces as well with Kansas Masonic Foundation and a variety of others. So as well as individual providers for us.
So I don't know that you can describe just in words how cool that simulation lab is in nursing. I mean, I had the chance to tour, and it's just amazing how, as someone who knows nothing about, the profession to speak of other than, maybe having been to the hospital a couple of times, it's just amazing how lifelike those simulators seem. It was amazing to me, and I highly encourage anyone when we can open things back up to check out that lab.
Yeah, and I see a few faces on the call who have been through that facility, and it is the simulation opportunities. These mannequins are so high fidelity that we can create scenarios that just aren't going to occur naturally as someone does a clinical rotation. So we can allow students to be exposed to scenarios and practice scenarios, and I mean, they make noises and they have bodily fluids, and they change the eye color, and it is really a tremendous learning experience. And as I said, a lot of our programs have really had to expand their simulation footprint. Our imaging group does a lot more simulation. Our athletic training folks do quite a bit of simulation now, and they integrate many of these simulations as well, knowing that as they go out and they work in an integrated healthcare setting, that they work with a variety of different providers as they meet the healthcare needs for our patrons.
You touched on this a little bit, and we actually have a question about this too. Talk about, especially with so many hands-on programs. I mean, we talked about nursing and allied health a little bit, but even speech language pathology, I know, certainly is a hands-on program to a certain degree. How have you had to adapt to the challenges, I guess I would say, of the pandemic?
Yeah, there's not a short answer to that. Our group, our faculty and staff and the department chairs have just done an absolutely phenomenal job starting in March, and probably thinking about it in February this past year of adapting on the run. And a big part of that is luckily we were able to leverage our expertise with technology. We've tried to create scenarios. I'm thinking of a particular example in nursing where they would go into the simulation lab, create a simulation which would typically include the entire class in that simulation, but they would zoom students into the simulation, and then the students would work to provide responses to the scenarios that were presented. Even though they couldn't be there live, they were viewing it in a way that still had an impact. Some of the challenges have been really difficult to overcome, and so when we had a little bit more flexibility, we were able to bring some students back in small groups with some appropriate management techniques to allow them some of the critical hands-on lab experiences that they had to finish. We were able to get everyone reasonably back on track for completion of their programs, even with the spring disruption, which included, for the most part, being eliminated from almost all of our partner facilities. So the students had their placements out in hospitals and clinics. We were in schools, we weren't able to continue in many of those placements. So we had to replace that. We used telepractice actually very heavily in a few areas. Speech language pathology specifically had already been doing some telepractice, specifically in a partnership down in Southwest Kansas, where we were working with school districts and providing speech language pathology services from Hayes through telepractice, and our students are involved. So we've expanded that, including in our own curriculum or in our own clinic here in the Herndon Clinic. And so all of the efforts that were made there were just really critical, and moving those things online that we could in the didactic sense, but knowing that there are a host of those hands-on experiences that have really been a challenge. Going into the fall, if at all possible, they've tried to front load those experiences, if we have a window to get those hands-on experiences in, and we have the theoretical underpinning to move forward with that, they've worked hard to try and do that as best as possible. So they've worked exceptionally hard to try and minimize the impact that this has had on the students. It's had a tremendous impact on our faculty. They worked awfully hard, but if we can minimize the impact on our students, on the quality of their educational experience, as well as the timeline of their educational experience, then we've done a great job. And so far we've really been able to do that. And every day when the phone rings, I hope it's not a department chair saying that we've been bumped out of a clinical site somewhere and having to come up with a new scenario. But we've had to stay really flexible with that. Right. And thoughtful, with student success at the forefront of our thought process. And that's the challenge. Student success isn't just getting them a degree. It is actually getting them the degree with the academic underpinning to be successful within that career, and to be able to successfully sit for their licensure and board and certification exams. Because if we can't educate them in a way that allows them to sit for those specialized credentials, which all of our programs have, then we haven't held up our part of the bargain.
Very good. So we do have some questions. I'm going to start with kind of a follow-up and I have to give a shout out to Austin Bickford, my former intern, is on the line here. And so hi, Austin. He's asking, and I guess I'm going to kind of rephrase it. You talked about telehealth in terms of a replacement for some of the clinical experiences. Going forward, do you see that being built more into the curriculum? We keep talking about how the pandemic is going to change how we do business. Do we see that being a bigger part of the curriculum moving forward?
Yeah, we really do. I think a lot of the things that we're doing now as a response to necessity will actually be embedded in the ways that we move forward. Our hybrid delivery models, where we're not as reliant on knowing that every Monday, Wednesday, Friday from 10:30 to 11:20, these students are going to sit in front of us. We will always have some sense of how we can maximize our time with students and make sure that it accentuates the learning curve for that. I think things like telepractice, which say speech language pathology has been using most prevalently, we expanded our ability to deliver that, one, in response to our needs currently, but knowing that this is something that will continue to be a need and is a reality out in the field right now. Many of our schools can't hire speech pathologists, and so they're actually contracting with telepractice delivery companies. And so our ability to teach our students those skills as well as deliver on our own, we're providing some of our own clinical experience through telepractice. It's just smart business. And so with the simulation and our ability to leverage technology, it will truly change how we move forward. And that's the other great thing about this, our people as our institution, is we're looking at these challenges as opportunities to just be better down the road. It's a tremendous amount of work for people right now, but we know that we're not just going to flip the switch and return back to the way we did it before. We will be able to use this to be better for our students and our constituents moving forward.
So this is not really a question, but BJ Reed says he hopes that Rose Arnold will continue to stay connected to social work in her retirement. So she was certainly a longtime faculty member, and so shout out to Rose if she's listening now or later. And then, so you talked about the importance of the Hansen Foundation and HaysMed and other partners, and that with their financial backing for some of the bigger items. What about scholarship funding and the importance for students in that way?
Yeah, that's really anything we can do to support our student experience, and it starts with scholarships and the ability to provide to enhance the opportunity for students to seek post-secondary education and specialized credentials, so that they can come back and populate our communities in Western Kansas. I think that's has to be our primary focus as a regional institution, is are we serving our region well? And as you mentioned, the Hansen Foundation, which prioritizes the 26 counties that make up that foundation, has been a great partner. The individual gifts that our people give towards scholarships are really, really critical for our ability to keep the cost to our students down. One of the things we've always promoted here is access to higher education, access to opportunity, and that access comes by providing great programs with great outcomes at an affordable cost. Access is built on cost, and then also delivery model has been part of our access story. As we're delivering, when I came here in 1998, we had about 800 students who we served at a distance, and I remember the goal was 5,000 at that time. Ago, that's silly, but Ed Hammond always seems to be right, and so here we are, and not that many years later, and we were serving 5,000 students at a distance. And so those students who used to have to drive in at night from Norton, Kansas, and from Goodland, were able to stay in those communities, and we were able to educate them in place, and they would then stay and be skilled professionals in those communities and continue to keep our rural communities vibrant. So that access model is important, and cost is a big part of that. We've done our part of it as an institution by keeping our tuition low, and that's been a challenge for us. But keep doing our part, and then if we can help with the student scholarships as well, that's really important. I say we at the institution, we just received some support from the Hansen Foundation, the second phase of a scholarship project whereby we provide full tuition scholarships for the last 2 years of a student's academic program if they will agree to go back to one of the 26 Hansen counties and work in that area of expertise. And so we have 15 students currently in that program, and we'll admit another 15. And it started as a conversation in the College of Health and Behavioral Sciences in the allied health professions, but we've broadened that to include a variety of high needs areas across campus. So we're real excited about that sort of partnership, because we know that Colby is going to need sonographers, ultrasound sonographers, and if we can scholarship a student with the idea that they're going to go back and they're going to work in Colby or St. Francis or in Phillipsburg, then that's a win-win for us. That's a win for the Hansen Foundation service area, and it's the Hansen Foundation, and for us as an institution to be able to support those students.
Very nice. So I don't have any other questions from the chat. Does anyone want to unmute yourself and ask a question? I can't see all of the audience, so we'll just let people proceed if they have questions that they want to ask.
This is Mark Giese in Tahlequah, Oklahoma, and Jeff, just to indicate you've done a great job up there all these years. Continue to do a good job.
Thank you, Giese. I tell you, and as I mentioned at the start, Fort Hays State University has been really good to me, and it started with just so many people that were willing to mentor a dumb kid from Broken Bow, Nebraska, who literally did not know what a credit hour was when he came to pre-enroll for his first semester of college. And Mark Giese was one of those guys that was really influential in my career, and I can list many of them. And I know that our people here at Fort Hays State University do that for countless thousands of our students through the years, including our students in our international programs, our 4,000 students in China and around the world.
Jeff, I have a question. Could you briefly describe that monster grant that the nursing department got?
Yes, that's a HRSA grant, and it is. I wish I could have prepped for that a little more intently, Gary, but it helps support the development of nurse practitioners. And so those nurse practitioners who are going to serve in rural, underserved areas get tuition scholarships for that. It also helps us help support the development of some of the academic experiences associated with the nurse practitioner program. And so the largest grant in the history of Fort Hays State University helps underwrite that. So Jenny Manry and her team over in the Department of Nursing put a tremendous amount of work into that. And it's been going great. The nurse practitioner program, what's now the DNP program, Doctor of Nurse Practitioner, the first doctoral program here at the university, has gone through a second round of graduates, and it's really influencing our opportunity to deliver healthcare in our rural communities in Western Kansas in general, but certainly in Western Kansas.
Thank you.
Do we have other questions? We have some kudos to you, Jeff, in the group chat. Nancy Vogel says hi from Lawrence. And Rob Scott says you did a great job today, which I think we all concur with. Last chance for questions. If not,
I do have that effect to kind of quiet a group pretty quick, that's for sure. Time to move on to something else.
I do have one more question. Jeff, weren't you in my biology class when you were a freshman? Freshman or sophomore, I sure was. Yeah.
You
and Brenda Hoopengarner as well.
Oh boy, we don't need to go there.
No, I remember it well up in Albertson Hall, and yeah. I'm going to guess I would have been sitting in the very back row of your class, and knowing that shouldn't have been my approach, but
yeah,
I think you're pretty intimidating.
Sleep most of the time.
I'll go back and look, but I'm pretty sure I got a pretty good grade in that class.
Yeah, I'll check that out.
You must not have had true academic rigor.
Well, I was going to ask if you wanted to, Gary, as a former faculty member, if you wanted to share any stories about the good doctor or Brenda or Harry as students from back in the day.
Well, as one who's been around Fort Hays forever, we're lucky to have Jeff Briggs as a dean. We're really lucky.
That's not the kind of story I was looking for.
Well, that's enough.
All right, very good. Any other questions out there? So without further ado, then let me thank Dr. Briggs for being with us. And I hope that all of you will join us in 2 weeks. We won't be having just one Tiger Tuesday. We will be having a week's worth of Tiger Tuesdays with our alumni award recipients. The whole schedule is on our website at goforthaystate.com. I know we have 2 of them, including a former faculty member in Jeff's college. I see Lynn Fenwick on the call, and I know that Marla Staub logged in as well, and those are both 2 of our Alumni Achievement Award recipients. But Tammy Welbrock and I will be splitting the duty that week, and we'll have a whole week's worth of great conversations with our alumni recipients. So we hope you will join us then, and then check out the entire schedule as we do Homecoming at Home 2020, starting the week of September 28th. So come join us. Thank you all again for joining us, and we hope to see you again soon.
Thank you all. Great to see you.